Causes of gum bleeding. You brush your teeth and see blood, and you've kind of gotten used to thinking everyone has this happen. But here's the question, is this really normal? Most people live with this for years, not even realizing what's actually happening in their mouths, and keep doing things that only make the situation worse. In this video, we'll figure out why gums start to bleed and how not to miss the moment when everything can still be easily fixed. Approximately 90% of the primary causes of gum bleeding are directly due to inadequate, improper, or highly irregular habits of brushing the teeth. After improper brushing or failing to brush at all, a sticky film of plaque forms on the teeth. If we do not effectively remove it within 48 hours, this plaque mineralizes and eventually turns into a hard calcified substance similar to real stone, which we also call tartar. And tartar is an ideal breeding ground and a true home for harmful bacteria. Bacteria actually live inside this tartar. And since bacteria multiply, their metabolic byproducts produce toxins, and it is these toxins that irritate the gums, causing the gums to become inflamed and as a result to bleed. The very first and main consequence of tartar is gingivitis. This is inflammation of the gums. That is, when we look at our tooth, it is surrounded by a little papilla or a cuff, right? And this gum tissue right around the tooth becomes inflamed. It turns red, loose, and in some cases even dark red or purplish. And it is the tartar that irritates this gum. So it's not just that the bacteria release toxins, but also that the tartar itself can hang over the gum and constantly injure it. Tartar also grows between the gum and the tooth. It is precisely because of tartar that the precursor to future problems develops if we don't pay attention to it. This, I repeat, is gingivitis, inflammation of the gum, and the patient notices it in their usual, let's say, routine. For example, when they take an apple, bite into it, and see blood right there on the apple. When the gum is healthy, when it is firm and pink, of course, even when chewing a regular apple, we would never be able to injure it. But with gingivitis, you will notice it immediately. And of course, you can also go up to a mirror, pull back your upper or lower lip, and take a close look. And of course, you can see how the gum, as I mentioned before, becomes red, loose, and may even be painful to the touch. That's why gingivitis is the first sign that the tooth needs help. It is precisely at the stage of gingivitis that everything can still be stopped and the process can be prevented from progressing further. If we ignore a condition like gingivitis, the process continues and the inflammation is no longer limited to just the papilla. And it should be noted that with gingivitis, there is no tooth mobility, and the ligament that is located directly in the bone and holds the tooth in place is not affected. And once again, I want to emphasize, everything can still be preserved at this stage. But if we don't do this, a much more serious disease develops, periodontitis. And this inflammatory process, these microbes, and also tartar, begin to penetrate deeper, right under the gum, between the teeth and the gum. As I mentioned, the tooth is held in place by a special ligament, and this ligament, due to inflammation caused by microbes, simply starts to disappear, so to speak. It breaks down. As a result, the gum begins to recede lower and lower because of the ongoing inflammation. We start to see the cementum of the tooth root, and the worst part is that the tooth becomes loose. So in addition to bleeding, the tooth also becomes loose. And of course, it's only logical that a strong odor appears, because the plaque or the microbes are so deep between the teeth and gums that we can't even see them ourselves. But with any movement or pressure on the gum, pus can actually come out from under the gum. The smell, of course, is unbelievable. That's why periodontitis is a very serious disease. And it's with this disease that many people say, I lost completely healthy teeth. That's exactly how it happens. A tooth that is otherwise perfectly healthy, no cavities, no decay, can literally just be pulled out by hand. This can happen specifically with periodontitis. Again, this happens because we didn't pay attention to it in time. Another separate cause of gum bleeding is traumatic factors. This is when we injure a completely healthy gum, there's no inflammation, no bacteria or microbes, but it happens specifically due to improper or rough brushing. This happens when we use a hard toothbrush or when we injure the gums with improper horizontal brushing motions, as well as when we use dental floss incorrectly. And of course, in this way, we can instantly damage our gums. The gums are actually very delicate, and they have a rich blood supply, so they can bleed quite heavily and easily. That's why it's very easy to tell whether your inflammation is gingivitis or if it's simply due to trauma you caused yourself. Of course, if you stop the factor causing trauma to your gums, meaning you stop brushing so aggressively on that side, still brush, but not as vigorously, then within a day, 2, or at most 3, any bleeding will go away. But if it's a disease, then of course that's different. No amount of brushing, even if you brush more gently, will help in this case. And among the specific causes of gum bleeding, we should mention systemic factors or harmful habits. First and foremost, we're talking about smoking. Smoking, in fact, is, although we see huge warnings and very serious diseases depicted on cigarette packs, we unfortunately tend to ignore them. But in reality, smoking and nicotine in particular have a very strong effect on the oral mucosa. That's why this can also be a cause of bleeding gums. And of course, there are diseases that are, let's say, related to vitamin deficiencies. Like, for example, you may have heard of scurvy. A lack of vitamin C can also lead to bleeding gums. There are certain diseases, such as leukemia, where bleeding can also occur. And the most common disease nowadays, a disease of modern times that unfortunately is affecting younger people every year, is diabetes. Diabetes can also lead to bleeding gums.
If we rule out the possibility that a person has injured themselves and they don't have any conditions like scurvy or anything else, then there is only one remaining cause. It means that tartar has accumulated. In other words, there are no other reasons.
Absolutely right. It is specifically the bacteria, or more precisely the products of their activity, that irritate the gums. It is they that trigger this kind of immune response in the body. So gum inflammation is nothing more than an immune response. This is how the gums react to these toxins. They give us a timely signal. In other words, the body itself is talking to us. Actually, in general, any illness is always a signal. So it's really a signal to do something. Therefore, these are pure toxins. And of course, if it is not a physical injury or some other medical diseases that are not directly related to the teeth, then most often the primary cause is dental tartar. It is specifically this kind of harmful bacterial factor that leads to these issues.
If a person notices that they have bleeding, say after brushing their teeth or even biting into an apple, what should they do in that case? Should they go see a doctor right after the first time?
You probably don't need to rush to the doctor after the first time. What would I do? I would brush my teeth thoroughly, then rinse with some kind of mouthwash. There are plenty available nowadays, and then keep an eye on it. So, as with any illness, our human awareness is very important. Therefore, as reasonable, mature adults, we simply observe the situation. So we've brushed our teeth, rinsed, and of course we observe for a day, 2 or 3. If the bleeding continues, if it doesn't stop, then of course that's a reason to definitely go see a dentist. So there's no need to rush to the dentist after the first time. We observe. If you see that this persists for 3 to 5 days, it's better to go and show it to a dentist just in case. And as I always say, there are now a huge number of dental clinics that offer free consultations. You just need to come and show the doctor. The doctor will immediately tell you the cause almost instantly.
And if, for example, a person noticed blood once, then it went away, and say 2 weeks later it appeared again, what should be done in that case?
In this case, I think the approach should be the same: observation. Such periodicity might be related to something. You need to monitor it. For example, sometimes it happens that we, say, bought a new toothbrush, right? And it really doesn't suit us. But we keep using it, and it's just a bit harder than usual. So we need to look for the reason, really try to find out why this is happening to you, right? But if we're talking about this kind of cyclic pattern, I'm sure there's already some kind of disease, most likely gingivitis, which flares up from time to time. That is, let's say the tartar isn't very pronounced. It's already there, yes, but it's not that noticeable, and inflammation occurs from time to time with the body managing to cope. So the less tartar there is, if there's a lot of tartar on the tooth, of course, the immune response will be constant and the inflammation will be ongoing. And when there's only a little tartar, when this infectious factor isn't so significant, the gums become inflamed, but the body copes and everything passes. But the tartar hasn't gone anywhere and the infection hasn't disappeared. And after some time, it happens again. So in this case, we just observe and stay calm. But if any questions arise, it's better to visit a dentist and have it checked.
They can see all of this on 3D scans.
You don't even need a 3D scan for this. It's enough just to open your mouth and the doctor will tell you right away in the chair. There are a lot of different instrumental methods. If the doctor has any questions, they use a special probe called a periodontal probe to check the depth of the pockets. So this is determined immediately, right during the appointment. I'm sure that after watching our video, you'll definitely be able to understand the cause of gum bleeding, and most importantly, you'll be able to save your perfectly healthy teeth in time. Subscribe to the channel, give us a like, take care of yourselves, and stay healthy.